Today we are gonna discuss the actions of the laryngeal muscles, but before going to the detail, we should know that there lies the external laryngeal muscles and internal as well. So the concept of external laryngeal muscles, they are supposed to connect your larynx with other parts of the body, like they have to connect with the hyoid bone and the pharyngeal apparatus as well. And you can quote the list of the muscle that include suprahyoid and the infrahyoid. Suprahyoid are supposed to elevate the hyoid and larynx, right? And the infrahyoid are supposed to depress your hyoid and larynx, right? And in addition to them, pharyngeal muscles do take part. Now the intrinsic muscles, what they are, basically they have to connect the different parts of the larynx with each other. Now we have to discuss the detailed function of the intrinsic laryngeal muscles, right? Now you can see the laryngeal apparatus and the various muscles. Their action becomes easier if we know that they are present as abductors, adductors, sphincters, relaxers and tensors. So let's get started. Now before going to the detail of the action, we should know that which is the inlet of the larynx, that is being marked by the blue circle, and you can see the green circle as well, that is showing the rima glottis. So make in mind that these both have to work together and different muscles are acting upon these two to make you talk and to make you whisper, and we can do breathing and a lot. Another good view to learn the inlet of the larynx, you can see the epiglottis anteriorly, laterally aryepiglottic folds, and posteriorly the arytenoid cartilages, and in the center the blue color ring is showing the rima glottis, which is being bounded by the true vocal cords, right? Now you are looking into the picture of the rima glottis and all intrinsic muscles around. See the abductors and the adductors. For the adductors, see lateral cricoarytenoid muscles present on both sides. Can you see what they are now trying to do? They have to pull the muscular process of the arytenoid cartilage, which I have marked with the letter M. They pull it anteriorly, and now what they are gonna do, they will rotate arytenoid cartilage in a sense that the vocal processes are supposed to move medially, and along with the other adductor muscles, which let me name them the transverse and oblique arytenoid, right? They have to pull arytenoid cartilage together, and in this way the air we are taking in through the rima glottis, they cause the vibration of the vocal ligament during phonation. Let me show you another picture in which the adduction is being shown, right? Now see, can you see the lateral cricoarytenoid? What it is trying to do? It is basically pulling the muscular process anteriorly, and what the vocal processes, they are supposed to swing medially. In this way, along with the help of the oblique and transverse arytenoid, they are doing the adduction of the intramembranous or you would say ligamentous part of the rima glottis to shut closer in phonation, or they are doing the function of adduction, right? Another important thing here to learn that you can see the vocal ligaments or vocal folds, they are approximated in adduction, but you would see that the intercartilaginous part of the rima glottis, let me mark, this one is the intermembranous part of the rima glottis, and this one is the intercartilaginous part. This part is still apart, and because the transverse arytenoid muscles are not now acting, and in this way the whispering occurs through this intercartilaginous part, and the breath is being modified, and what is happening that there is no tone of the voice, just whispering occurs, right? Now concentrate the picture in which you can see the adducted vocal cords and the muscles posterior cricoarytenoid, which is your only abductor and life-saving muscle, I would say. What it is trying to do, basically it has to pull the, let me show the muscular process of the retinoid cartilage posteriorly or medially. In this way, it is able to rotate the vocal processes laterally, so they are keeping your rima glottis wide, right? And this widening causes the inspiration, deep inspiration, that is managed easily, right? Okay, now we have to concentrate this picture to see the inlet of the larynx, in which you can see the epiglottics, the aryepiglottic folds, and of course the posteriorly lying cartilages and muscles. Now what is going to happen? The sphincters and they collectively act, and when your laryngeal inlet is closing by the sphincters, that is basically a protective mechanism during swallowing. And what is going to happen? The contraction of the lateral cricoarytenoid, transverse and oblique, and of course the aryepiglottic fold carrying the aryepiglottic muscles. They bring the folds of the aryepiglottic closer, and in this way the arytenoid cartilage is being pulled closer to that of your epiglottis. Let me mark that this area and this area, they are supposed to act under the sphincters, and in this way reflexly the presence of any fluid or any particle, any food is not supposed to get entry into your vestibular part of the larynx. So we would say a strongest reflex is there, and that maintains our not entry of the food particle in the larynx. Now we have to concentrate on the tensor muscles. Let me quote the cricothyroid. It has got the vertical and oblique fibers. Let me show you it in another diagram also. Now learn the action of cricothyroid. You can see that this is the arytenoid cartilage and this is the angle of the thyroid cartilage. Now what is going to happen? The action of cricothyroid is bringing the thyroid cartilage, you would say, anteriorly and inferiorly towards the cricoid cartilage. And what is going to happen? That increases the distance between the thyroid prominence and the arytenoid cartilages. And this is how the vocal ligaments are now being tensed, elongated and tightened, so rising the pitch of your voice, right? Now here in this picture we can concentrate the relaxers of your larynx, and the thyroarytenoid muscles are there, you can see in the picture. And let me mark, this is the place of the arytenoid cartilage and this is the thyroid cartilage. Now what this muscle has to do? It will pull the arytenoid cartilages anteriorly towards the thyroid, right? And what happens? That it will now relaxing your vocal ligament and will lower your pitch of the voice, right? Okay, now we have to learn the very important function of the vocalis muscle. What is gonna happen here? You see that this vocalis muscle lies in between the vocal fold or vocal cord medially, and laterally it has got thyroarytenoid muscle. What is going to happen? Now this vocalis muscle produce a fine adjustment into your vocal ligaments, and in this way it has to selectively tense and relax the anterior posterior parts of your vocal folds, and in this way your animated voice or speech and singing is maintained, right? Now a little bit about the nerve supply of this laryngeal apparatus and its muscles, right? So concentrate, there is the vagus nerve, the 10th cranial nerve, that give rise to superior laryngeal nerve. This superior laryngeal nerve is going to divide into the external laryngeal branch and the internal laryngeal branch. And you can see that internal laryngeal branch is going to pierce the thyroid membrane, right? And see, the vagus is coming down and it give rise to recurrent laryngeal nerve. You can see this recurrent laryngeal nerve, which on its termination give rise to inferior laryngeal nerve. So all of the intrinsic muscles of the larynx are being supplied by the recurrent laryngeal nerve, except the muscle called cricothyroid, which is supplied by the external laryngeal nerve, right?